Although there are no reported cases of swine flu here in Chicago, health officials are taking precautions just in case.
Joining us is ER Dr. Sudip Bose with Advocate Christ Medical Center. We thank you for joining us this morning.
Thank you for having me.
I saw one of the victims of the swine flu here in the United States. So he looked like a young jock, somebody very healthy. So I'm concerned with who these people are who have died from it so far. Do they have prior medical conditions?
You think it's elderly or very young, but these are actually healthy individuals that are susceptible to this
virus.
Flu.
Right. I mean, that is one of the unique features of this strain, and the reason this happens is because it's the immune reaction to the viral strains. So normally the flu strain affects elderly, immunocompromised, but here your immune system basically revs up, and you get these inflammatory cells, and they basically can flood your lungs.
Yeah. How do you die from the flu?
Usually it's a complication of the flu. You can get a pneumonia, for instance. You can have spread to the brain. You can get septic from it. And those are usually the causes. But I think one of the main points I'd like to make is these are the stories you hear on the news. Mm-hmm. But, we should be alert. We should be aware of this. But we shouldn't be panicked by it. I think there is a level of responsibility. I think the government, the Health and Human Services, and the media through outlets such as this have done a wonderful job informing the public. And we need to take this information, but not panic with it.
Sure. Yeah, do you have people coming into the emergency room and I got the swine flu, I think?
I think the main thing here is to recognize, which symptoms need to go to the emergency room and which ones are just flu symptoms that may not need to go to the emergency room. So, for instance, if you probably weren't sick enough to go to the emergency room in the first place until you saw a show like this, you probably don't need to go. Whereas, complications like pneumonia, if you get chest pain or a lot of trouble breathing, that may be something that you may need to go to the hospital for.
One thing you're seeing a lot these days, too, as we show this video, people are buying these masks. And I'm concerned, is this going to protect you, these masks, or is it mostly going to protect other people from you if you were to have a cough or if you yourself were to have the flu? Why are these people getting masks now?
The mask is, one piece of the picture and one piece of the puzzle. The mask is not foolproof. You can't just wear the mask and be 100% protected. I think what's more important is to take basic precautions, washing your hands and things that we learned as a child, cover your mouth when you cough and sneeze. And, these are things that we just have to be reminded every now and then.
Just basic things. Right. So why did the World Health Organization raise the alert level?
And that's one of the brilliant things about media now is we can inform the public when at the earlier stages. And this is definitely an issue now, and we need to be aware of it.
Because on the surface, I think you make a good point. I mean, we don't need to panic. I mean, there's 50 people in the country right now who have been diagnosed with this particular flu strain.
But at the same time, I'm sitting around yesterday and I get a little cough, and I think to myself, is this?
And then you see the World Health Organization raising the alert level, which is 2 levels down from it being a full-blown pandemic.
Right.
Why? What's the point of that?
I think, we need to be alert, again, just to be aware of what symptoms are out there, to recognize them early so we can take personal responsibility, to know, okay, this is the time where we take extra precaution, cover our nose and our mouth when we sneeze. Remember, it lives on surfaces, so, just basic things like washing your hands. It's on money, it's on other people's hands, it can be on hand railings, and,
Good sanitation.
Back in the 1800s, there was a physician, Semmelweis, who recognized that, by washing hands, here's an OB doctor, I'm preventing more infections in mothers and in babies than, lots of antibiotics.
It's incredible, yeah.
So just basics like that, just going back to that and taking responsibility and not getting in situations like big groups where if you're sick, this is not the time to go to work and spread it to your colleagues who spread it to their kids.
And finally, we have 15 seconds. What's the difference between a pandemic and epidemic?
Basically the amount of spread. So pandemic's going to affect a large geographic area.
Okay.
So if it spreads to the entire North America, that would be a pandemic.
All right, Dr. Bose, thank you so much for joining us this morning.
Thank you for having me.